I explain anesthesia to my patients in a way to make it as easy to understand as possible. So what I mean by that is I tell them when we have surgery that would, without anesthetic, be very uncomfortable. They would be awake, they would feel the pain, they would hear the noises. What anesthesia does, it creates a state of unconsciousness. And unconsciousness is not sleep, but it's very similar to sleep. And it means the patient is very, very deeply unconscious, so does not hear anything, does not feel anything, and is there comfortable while I watch and make sure that all the body functions are in order. My workdays start early, so I arrive in the operating theatre about an hour before the surgeons arrive. I make sure that all the equipment that we need is here, all the drugs are here. I go and see the patients, introduce myself, I check that they're safe to have an anaesthetic, that they're not having any health issues that could make things complicated or dangerous for them. And I also explain exactly what we're going to do and how the day is going to look like for them. What I enjoy most about my job actually is the patient contact. I know it's a very stressful day for a patient when they come to hospital, when they have surgery, when they know that they are unwell and that they're undergoing a big procedure. And even though I only see my patients for a very short period of time, this is a very important period of time, I feel, where I can get to know them, not only based on their medical conditions, but also get them to know as a person, help them make this stressful time more relaxed. Well, in my medical assessment, I also ask questions that are personal to the patient. I like to ask them what they would normally be doing today if they wouldn't be here having the surgery, or I ask questions about their family, the kids, the last holidays, just something little to take their mind off of the place where they are at the moment and remind them of something happy and relaxing instead. Most commonly they ask me, some patients are scared, they hear horror stories that are extremely rare to happen. So some patients are worried about waking up during surgery, some patients are worried about the pain afterwards, some patients worry about their general disease and the surgery for what they are here for. So I try to take their mind at ease and help them to get through it. Well, there's more than one piece of advice. The first one is to really follow the pre-anesthetic assessment guidelines involving the fasting and also involving their regular medications. But from a non-clinical perspective, I would say you can trust the process. You will be looked after by a specialist, by somebody who went through years and years of training, whose only and main role in an operating theatre is to have you safe. So you can relax and be sure that everything will be okay.